Have you ever accidentally fallen asleep with your breastfeeding baby? For years, we've recommended no co-sleeping because of the real risk of SIDS. But the reality is that co-sleeping happens, and it may not always be planned, especially if you're breastfeeding. So if it does happen, here are a few tips from the Academy of Breastfeeding Medicine to make breastfeeding and sleeping at night as safe as possible. Number one is to feed your baby at night in a safe bed, not a sofa, a chair, or a recliner. You want to use a firm, flat mattress with the bed away from all walls and no small spaces around the edge of the bed where your baby could get trapped. Consider putting your mattress on the floor even for the safest space. Don't use a guardrail on an adult bed. Place your baby on their back at the level of your breast and lay in the cuddle curl position, which we'll talk about. Make sure there are no heavy blankets, extra pillows, or cords dangling near the bed. Sheets, blankets should be low so that they don't cover your baby's face or head. Don't leave your baby alone on an adult bed. No one should sleep with your baby on a sofa, recliner, or a chair. If they've recently used alcohol, drugs, or medication that makes them sleepy, or if they smoke, or if your baby was born premature or with a low birth weight. When you're not bed sharing, always place your baby on their back to sleep. Keep your baby in a room near your bed. Consider using a bassinet or co-sleeper that attaches to your bed. Put your baby in a clear, flat space after feeding. Do not put your baby in a bed with cushioned sides. Now, a little more about the cuddle curl. This is the safest bed sharing position for breastfeeding. Number one, you place your baby on their back while you lay on your side facing the baby. Your baby's head should be aligned with your breast, but not facing. Your legs should be bent or curled under your baby to prevent him or her from sliding down. Your arm that's underneath your body should be curled up and around your baby to prevent him from moving up. Lastly, keep your hair up and out of your baby's face. Of course, you want to make sure that you're maintaining a safe sleep environment based on the SIDS requirements and that your baby is not swaddled throughout this.